New research has revealed a concerning increase in tobacco use, with most now coming from illicit sources. Live now to Professor James Martin from Deakin University. Professor, thanks so much for joining us. We know that latest research shows that consumption of tobacco has increased by 40% in the last 8 years. Why?
Well, I think this has really been a product of well-intentioned but unrealistic public health policies, principally the increases of taxes on tobacco. We now have the most expensive tobacco in the world. A pack-a-day smoker who wants to buy legal cigarettes is looking at a yearly bill of around $15,000, and that's a price that most smokers are unable or unwilling to pay.
So in regards to, we know the illicit tobacco wars are exploding right across the country. How much consumption of illicit tobacco are Australians doing at the moment?
Well, extraordinary amounts. So despite the increasing taxes that we have and the ban on less harmful nicotine products such as vapes, Australians are still consuming these products in record quantities, and that's providing an absolutely massive income stream for organised crime. We're talking around $8.5 billion per year going into their hands, and that makes nicotine now a more attractive criminal commodity than cannabis, cocaine, heroin and ecstasy combined.
So clearly the increasing taxes is not working on decreasing consumption of tobacco. What do you think the governments need to do?
Well, it's clear that enforcement alone won't solve this problem. Police themselves have said as much, that we can't arrest our way out of this problem. There aren't enough jail cells in the country to imprison all the people that are selling illicit tobacco. So we really need to look to directing consumers back into the legal market. So that would involve, I think, a very substantial cut to tobacco excise, such as what the Canadians did back in the 1990s, and also legalising, creating a legal regulated market for vapes and other less harmful nicotine products.
Professor, we know over recent years there has been really hard-hitting educational campaigns about the danger of vaping and also tobacco. Do you think they're actually effective anymore?
No, and I think they're actually misinforming people about the relative risks of less harmful nicotine products such as vapes and smoking. We know that smoking is a leading cause of preventable death, but in other countries, so the UK and New Zealand, for example, the health messaging is very clear, and that is if you smoke, you should switch to vaping to improve your health. In fact, in both of those countries, they even have free switch to quit schemes where if you smoke, you can get a free vape at taxpayer expense to get you to quit cigarettes. So here, I think the health messaging has actually been rather confusing, and there's been increasing misunderstanding that vapes are actually less harmful to health.
So we know about the issues, though, also with the dangers with vaping. Are you saying vaping is safer than consuming nicotine?
Well, I think it's demonstrably, yes, a less harmful form of ingesting nicotine. Nicotine harms exist on a spectrum. So we've got tobacco smoking up the one end, by far the most harmful, and down the other end you have things like nicotine gums and sprays, which anyone can buy legally at any supermarket around the country. Nicotine pouches fall closer to that end, and vapes somewhere in the middle. So I think we should be, from a harm reduction perspective, making those less harmful products more accessible than deadly cigarettes.
We appreciate your time this afternoon. Thanks so much, Professor.
Thanks.